Good afternoon, one and all present here. Myself, Dr. Vedantam Krishna Teja. I am from second year PG Scholars. Today's topic is what is Udvartana? We all know that Udvartanam Kafaharam Medasa Pravilayanam Sthirikaranam Anganam Tok Prasadakaram Param. Nothing but Udvartana containing two words. One is Urdhva. Urdhva means upward. This friction will cause some heat and this will produce the proper effect of this Udvartana therapy. And we will see the difference between Udgarshana and Utsadhana. Asneha Aushadab Churnadibihi Garshanam Udgarshanam. And what is Utsadhana? Sasneha Kalkena Udgarshanam Utsadhanam. There is a difference between Udgarshana and Utsadhana is nothing but about using of Sneha. Sneha Darya means usually we will use the Udvartana generally like Kolakulata Churna or Triphalada Churna as a Udvartana. Now we are taking a different form of Udvartana, which means now we have a question that is it possible that we can perform Udgarshana with Ishtika Churna, which is nothing but a brick powder. And there is one more question, is there any reference for Ishtika Churna Udvartana in Samhitas? Yes, we have a reference of Ishtika Churna Udvartana in Samhitas. Susruta Samhita Chikitsa Sana, 24th chapter, 56th sloka. We can see that red line which I got marked. Udgarshanam Ishtikaya Kota Kandu Kota Vinashanam, which means it will reduce the Kota and Kandu. Nothing but we can correlate in English modern terminology like urticaria or this thing. And now we will go through how the Ishtika Churna is prepared. First we collected a clay from the river bed, which is nothing but a Nadi Mritika, which is having more purity than the normal clay. And we got processed and we given it in a local brick factory and we made it as this form brick in 1000 to 1200 degrees centigrade. Then we took the brick into a Kalvayantra, make it into powder. I used a sieve number 420 micron sieve number. And I sieved the churna through like this way. We got a fine powder at last. Finally, I sent that sample to the chemical examination. We got the final result as silica having 55%, aluminium having 30%, iron oxide having 8%, and magnesia, lime and organic matter as 1%. And particle size is about 420 microns I used. Now we are entering into the case study. Patient aged female aged of 40 years came to our OPD having these are the things. We'll enter into the chief complaints of the patient. Actually, she had been suffering from chronic urticaria since 1 year and eruptions occurred daily before she went to the sleep. At night time only it getting aggravating and caused a severe itching and burning sensation. There was a swelling around the rashes. Eruptions are eruptions with light brown color, having small in size, irregular in shape, hard, nodular and wheel type. The main thing is wheel. Clearly demarcated. They persist of few minutes to half an hour. Usually, generally per day, she is having more than 4 to 5 times. That too at night time, she is having more itching. And she is also having a stress and sleeplessness and migraine from since 2 years. She is also having a gastritis. The patient reported that she took allopathic treatment for the cure of urticaria, but there is no complete cure in allopathy, and we came and they approached to the Ayurveda. We can see the family history, there is no such illness. We can see the drug history. Actually, she is taking daily Rantac morning and night before food. Daily she is taking Vasopressin tablet, and Fexofenadine tablet, and Montelukast and Levocetirizine daily, even without missing one day also. We can see the personal history. Appetite is poor, bowel is constipated, maturation is normal, and sleep is disturbed. These are the Ashtaveda Pariksha and Dashaveda Pariksha of the patient. We can see the therapeutic intervention. First, I took treatment as a 7 days of the treatment. First, I used as a Sarvanga Ishtika Udvartana. The main thing is this. Without there is no Purva Karma like came to OPD with this pics on the first day before the treatment. You can see that round lesions are there in hand and leg and bilateral hand and right side of the leg. This is the third day of the treatment. You can see there is a little reduction, not completely. You can see on the fifth day there is a little, almost compared to starting, 50 to 60% got reduced. Even frequency also got reduced. On the seventh day, the final day, I asked about the patient. There is no frequency. Even once in a day also, she is not even finding a itching or there is no lesions on the skin. Compared to first day, there is almost complete, almost like 90 to 95% there is a reduction of the urticaria lesions. You can see that final conclusion is like Ishtika Churna Udvartana is helped in subsiding symptoms and frequency of the occurring rashes to the patient. This Udvartana will reduces the Kapha Guna which is subsiding in the skin and also reduces the Vata Guna. Generally we use as a Udvartana, generally we will use Kolakulattadi and Tifladi Udvartana everywhere. But there is a unique Udvartana Churna which is presented here, which is already mentioned in our classics, but there is a nowhere usage of this Churna is there. But when I am searching for my thesis, I got this one. Then I followed it on why not we will try it on the patients. So I tried it, it was successfully worked. I tried it more than 5 patients. As a pilot study I did. There is a almost 95% cure in every patient. Actually it was working on every patient. This is my experience of this sharing this topic. Thank you. Thank you one and all.
Next, Dr. Ebalina.
My PG studies from JSPS Government Homeopathic Medical College, Hyderabad. So the topic of my presentation today is the treatment of palmar and plantar warts by homeopathy, a clinical case study. So let us begin this presentation by understanding that what are warts. So warts are growths seen on the mucosa and the skin which are caused by human papilloma virus, also known as HPV. So there are many types of HPV and they can occur at any site. The primary manifestations being the genital warts, the flat warts, the palmar warts and the plantar warts. Usually diagnosis of warts are done through clinical examination and they very rarely require a biopsy. In conventional system of medicine, we will see that the most common treatment done is by the application of salicylic acid solution and by liquid nitrogen, also known as cryotherapy. So, a study conducted by Liao and Un on the impact of viral warts on the quality of life of patients emphasized that patients suffering from warts were most frustrated with the persistence and recurrence of viral warts and the time taken for the treatment. And another important conclusion is that alternative treatments could be resorted and could be used in cases where allopathic treatment fails. So now, the homeopathic approach in the treatment of warts is holistic, individualistic and gentle. These three important terms will be cleared, the concept will be cleared as we go on with the presentation. So now coming to the purpose of the study. According to the American Association of Dermatology, it says that warts are harmful. So if warts are not harmful, why do we require treatment? The reason is that warts can become bothersome and unattractive, and and some people who suffer from them, they may be feeling ashamed by their appearance, and it actually affects the confidence of the patients and also their self-esteem. So they resort to treatment of warts. So According to the standard treatment guidelines in homeopathy by CCRH published under the Ministry of Ayush, warts are common worldwide and affect about 10% of the population. And a study conducted in India showed that 46.03% of the population affected with warts, the prevalent age was from 14 to 20 years of age. So now coming back to the purpose of the study, the main purpose is to evaluate the efficacy of the homeopathic medicines in the treatment of palmar and plantar warts. So now coming to the design of the study, it is a clinical case study of two cases. The first case being of palmar warts and the second being of plantar warts. The study setting, the OPD of JSPS Government Homeopathic Medical College, Hyderabad. We can see here in the picture. Now coming to the inclusion criteria. Patients of all age groups, both sexes, chronic and acute cases are included, and cases of warts with comorbidities were excluded. Now, the methodology adopted was that each case was individualized according to homeopathic principles and a single medicine was prescribed. And Zomeo Pro 14.0 version software was used for repertorization. This is usually done to encourage evidence-based medicine and also to prevent biasness in the selection of medicine. Now coming to the next slide, here we have the repertorial analysis taken from the software. So in both the cases, it is important, I will try to emphasize here, that in both the cases, the mental plane, the physical plane, and the emotional plane of the state of the patient was taken into consideration. So we can see here in the repertorial analysis, Anton Krug, in the first case, you can see that Anton Krug covered all these mental, physical, and emotional plane in the case. And in the second case, we will see here nitric acid, NIT-AC, though it occupied the second position in the repertorial analysis, it was prescribed to the patient. This was because the main complaint of the patient, along with the mental sphere of the patient, was covered by this remedy. As such, we prescribe this remedy. Here we have the detail of the cases. It is actually the same as the repertorial analysis, but it was just given as a narrative form of as such. He burned them thinking that they will disappear, but they did not. And thereafter, he came to our OPD for treatment. This is also a pictorial evidence. We can see that the warts have disappeared, leaving no scars. And finally, even the second case, the case of plantar warts, we can see that all the warts have disappeared, leaving no scars, and leading to the conclusion that the medicine, the medicines prescribed through homeopathic principles were successful in the treatment of the warts. And the homeopathic approach to the treatment of warts is holistic, where the mental, physical and emotional plane were covered, individualistic, where the individual nature of each patient was respected, and gentle, where the sweet pills of homeopathy were given without any topical applications, without any excisions, any surgery. And to conclude, we are currently witnessing a trend now, where complementary and alternative medicine are no longer becoming alternative. They are actually becoming mainstream, especially in skin conditions, because of the holistic approach of the complementary and alternative system of medicine. So we need to explore further and to tap into the potential of our Ayush systems of medicines, which are buried deep in holism, so that the fruits can be reaped by us. And the declaration of patient consent, they had consented to the photos and their identities were not disclosed. And finally, I would like to thank our principal and my guide.
Hello. Time up.
Okay, thank you. Thank you all for your attention.
To respected chair and co-chair present over here and all the respected dignitaries. Myself, Dr. Ranjit Kumar Kora, second year PG scholar, PG Department of Panchkarma, Dr. B.R.K.R. Ayurvedic College, Vijay, Hyderabad, guided by Dr. Praveen Kumar Sir, Associate Professor, PG Department, and Dr. Johar Sir, Professor and HOD, Dr. B.R.K.R. College. My topic is management of urethral stricture, Mutramarga Samkoja by Virechana Uttara Uttaravasti and Avapidaka Snehapana, a case report. So introduction, from the study of ancient surgical tests, it was already mentioned in the classics regarding Mutragata. So it was evident that the urological problems are important part of medical sciences during those days. It may be the reason that a clear and striking picture regarding the classification, symptomology and complications and management has been explained in classical texts. In Acharya Vagbhata divided the Mutra Rogas into two categories, that is Mutra Apravrutaja and Atipravrutaja. That is Atipravrutaja means increased urination and Apravrutaja means decreased urination. So Atipravrutaja that deals with Premeha and Apravrutaja comes with Ashmari, Mutrakucha and Mutragata. So Mutragata is mentioned by Sushruta around 400 AD. So different authors have mentioned, our classics Madhavakara described Mutragata separately in Madhavanidan, and Mutragata also mentioned by Bhava Prakasha, Baishaj Ratnavali, Sarangdara and Yogaratnakara. Medical or functional related to either upper or lower urinary tract, resulting either partial or complete retention of urine as well as oliguria as anuria. That is complete absence of urination or partial or complete retention of the urine is present. The present study is concerned with Mutramarga Samkocha, a condition affecting the Mutravasrotas. In this condition, there is an obstructive flow, straining, dribbling and prolonged micturition. So what is the purpose of the study? So Mutramarga Samkocha can be correlated with urethral stricture. Pathologically, it becomes narrowed by fibrotic tissue which hampers the excretion of the urine. In modern science, the suggested treatment is urethral dilatation. Besides surgical treatment, it may cause false bleeding, false passage and fistula formation. The surgical intervention like urethroplasty also carries high grade risk of reoccurrences. Though the science has developed in many directions, it is unable to provide satisfactory treatment to patients without any complications. Hence, the treatment protocol followed is Sushruta line of management, that is Sneha Svedopapannanam Hitam Tesham Virechanam Tada Samshuddha Dehanam Hitascha Uttar Bastayata, according to Sushruta Uttara Tantra. So, after unction and sudation therapies, purgation should be given, and therefore, when the body is cleansed, urethral doubt should be applied. Hence, the present study is taken as to evaluate the role of Virechana Yukta Uttaravasti and Avapidaka Snehapana in Mutragata. So coming to the design of the study, in the present case study, a 38-year-old male patient came to the OPD of Department of Panchkarma and presented with a history of increased frequency of micturition, weak stream, dribbling and staining at the time of urination. That was since 2 years. The date of first OPD is 22nd/10. Specific routine and specific investigations were done, and patient has a previous reports of treatment done at a allopathy hospital. It includes frequency of micturition, weak stream, dribbling and staining at the time of urination since 1 month, and there was a retrograde ureterogram done by a neurologist at that time, and the report specified acute narrowing noted at the bulbar urethra, that is bulbar urethral stricture. So patient went for the treatment DVIU, direct vision internal urethrotomy, and 18 Foley's catheter was placed, and after DVIU patient had a relief for 1 month, and again the symptoms reappeared. So coming to the anatomy of urethral stricture, what is urethral stricture? A stricture is the narrowing of the urethra, a tube that is connected to the bladder that allows the passing of the urine. The narrowing reduces the flow in urine and makes it difficult or even painful to empty the bladder. So urethral stricture is caused by, what are the causes? Injury, instrumentation, infection and certain non-infectious forms of urethritis. The condition is more common in men due to it is 18 to 20 centimeters long. It is divided into anterior and posterior. Next intervention, Acharya Sushruta had classified Mutragata, obstructive and suppressive uropathies into 12 types as per the test by etiological factors of Mutragata. Mentioned are vitiation of doshas, humor, agata and trauma. These are the causative factors. The symptoms given are sakchesta, that is straining, sadaha, burning and murmu mutra pravritti, that is frequent micturition. So treatment of Mutragata includes Sneha Svedopapannanam, hitam tesham virechanam tada samshuddha dehanam hitascha uttarpascha. In Ayurveda, the treatment of Mutragata includes first is Sneha, ovulation, followed by Sweda, unction, latter is Virechana, so complete protocol followed by Uttarvasti. So next protocol is Avapedaka Snehapana. So timelines, treatment protocol, it includes, so first is Virechana, it includes Depana and Pachana for 3 days, 4 to 5 mildly symptomatic, 6 to 10 moderate, and 11 to 15 is severely symptomatic. So result, parametric assessment, before treatment total assessment was 13, that is severely symptomatic, and after treatment they came to 2, that is mildly symptomatic. So diagram, this is radiographic differentiation before and after treatment. So this is the bulbar urethral stricture. Initially there was stricture, and later after the treatment the stricture was resolved. So discussion, the probable mode of action of therapy to be discussed. Snehapana helps to bring the doshas from Shaka to Kosta, mainly Vata and Kapha being the predominant doshas. Next, Shatavari Kruta is indicated in Mutragata as having Vata Pittahara properties. So Virechana helps to elevate the Pitta. So Uttarvasti is done with Dhanvantri Tela, that is Vata Kaphara, along with Sharatera that has Lakana property. So mode of action of Avapedaka Snehapana as Shamana Snehapana to be discussed, done with Sukumar Gutta having Vata Anlomna along with Vata Pittahara property. So that is useful as Shamana Snehapana. So the efficacy of combined treatment outcome to conquer the situation. So conclusion is final outcome in comparison with initial and final retrograde urethra for assessment of the disease. So parametric assessment before treatment is 13 and after treatment is 2. When compared, the treatment protocol used is effective in the present context. Thank you.
Prishtashula, Vata Prakopa in the Kati region which affects the Asti and Mamsa Dhatu in Kati Pradesha causes Katishula. Nidana of Katishula, Ati Vyayama, Ati Yana, Ati Maituna, Ati Hasata, Vegan Dharana, Ahara Dravyash, Ruksha Dravya Sevana, Ati Sheetalapana, Viruddha Ahara. Bending forward to touch ground. It is advised patient with extend warm water, Nirgundi Thailam for external application. After taking this treatment for 15 days, patient is advised to take physiotherapy and include ergonomic changes in daily activities. After 15 days, pain effect on lumbar region got reduced. McKenzie method improves stability and motility of the patient. Ergonomic changes advised to reduce the pain, cost effective, range of the motion of patient is increased. Conclusion. Study concludes that the combined effect of Ayurveda and physiotherapy in treating chronic low back pain will give very noticeable improvement in the subject as the treatment prescribed in Ayurveda reduces the chronic pain. McKenzie method improves strength, motility and stability of the muscles of lumbar region. Ergonomic changes will avoid the effect of any risk factors to cause any future development of pain and any instability in.
Thank you, Doctor. Remarks.
Good afternoon, everyone. All the present platform to combine all the systems of Ayush at one place. So it's a marvelous idea of I congratulate all the presenters for their good presentation, and the winners will be announced very shortly. Thank you.
Congratulations, Doctor. Within a few minutes, we'll be calling up all the participants to request the certificates after felicitation of the dignitaries. Students, sir? First students, sir? Okay. Dr. Dharam Singh. నా సెల్ ఎక్కడ పెట్టాను ఇప్పుడు సేమా Next, Dr. Deepak. Hey, Dr. Dharam Singh. Hello. Okay. ఎవరివి కూడా పేర్లు లేవా ఓకే సరే నా ఫోన్ ఎక్కడ పెట్టాను ఇప్పుడు అదే చూసి అక్కడ పెట్టినట్టున డాక్టర్ కృష్ణతేజ. డాక్టర్ రేభాలీనా. ఇక్కడ దొరికిందా? ప్లీజ్ ఇచ్చారా అమ్మకి? డాక్టర్ రంజిత్ కుమార్. ఆ అమ్మాయి పేరు రాసింది అక్కడ పెట్టుంది. డాక్టర్ రచన. అంతే. డాక్టర్ రుషాలి. నెక్స్ట్ వీళ్ళ ఫెల్ స్టేషన్కి ఉంది. రిక్వెస్ట్ సత్యనారాయణ సార్ టు ఫెల్ స్టేట్ రాజలక్ష్మి మేడం. So participants request all the paper presenters onto the dais for group. ఒక్క నిమిషం.